Let's talk about testicular cancer. Testicular cancer is nothing but it is a uncontrolled growth of abnormal cells in the testes. Even though it is very rare, especially in the Indian population, it is a very rare cancer. It happens around one person in 1 lakh can get affected by this cancer, and commonly it is seen in the age group of 20 to 40 years age group. There is no particular cause as such, but there are risk factors for the testis cancer that you should know. For example, any family history of testis cancer, like a father or brothers having a testis cancer, or any history of undescended testis. That means like testis not coming down into the scrotum. That is also a risk factor for the testis cancer. And finally, testis cancer in the opposite side. The person who already had this testis cancer in the opposite side can have a testis cancer in the remaining testis. The most common symptom is any lump in the testis. And the second one, rarely patient can have a pain in the testis. So when you notice any unusual increase in the size of the testis or any change in the shape of the testis, you should seek a medical attention. A diagnosis starts with the patient. So patient has to perform regular self-testicular examination. If he notices any unusual swelling, he has to see us. When he comes to us, we do few tests. The test starts with doing the ultrasound scan. We look for any growth in the testis and character of the testis, and followed by we do a few blood tests to see any markers in the blood which indicates towards testicular cancer, and sometimes these blood tests will give us the idea about the type of the testicular cancer. And commonly the germs or tumors are the most common testicular cancers we see. And once we diagnose, suspect strongly the testicular cancer, usually we need to remove the testis to confirm the diagnosis of testis cancer. Generally biopsy is not advised for the testis cancer. We need to remove the testis, and we send for the biopsy examination. So once it is confirmed as a testicular cancer, we stage the disease. If it is an early stage, just removing testis is enough. If it is an advanced stage, we have to consider different modalities of treatment like chemotherapy, radiation therapy, sometimes abdominal surgery also we need to do. There are no specific measures to prevent the testis cancer, and as I discussed earlier, the self-testicular examination monthly once is very important. And the good news about the testis cancer is that it has got 95% of cure rates. So early detection is the key. Self-testicular examination is the key.